Breathing is the process of ventilating air into and out of your lungs. To understand this further, some basics need to be covered. Air flows from higher to lower pressure. Pressure and volume are inversely related. Therefore, pressure increases when volume decreases and vice versa. Volume of a given amount of gas increases with increased temperature. When the pressure outside the thoracic cavity or atmospheric pressure equals the pressure inside the thoracic cavity or intrapulmonary pressure, there will be no movement of air. However, when we control the size of our thoracic cavity using breathing muscles, we can increase or decrease the pressure inside the lungs relative to atmospheric pressure. This will cause air to move in and out of the lungs. Recall that there is a thin layer of serous fluid created by visceral and parietal pleural membrane lining the lungs and thoracic cavity. In healthy individuals, the pressure of the intrapleural space is average -4 millimeters of mercury of pressure relative to the pleural space. This negative pressure smashes the lungs against the chest cavity, keeping them open. If the negative pressure were to be compromised, as in a pneumothorax, the lungs may collapse. Producing changes in the size of the thoracic cavity will cause air to exit and enter the lungs. To inspire air, the external intercostal and diaphragm muscles contract. This increases the volume in the thoracic cavity, thus decreasing pressure. When atmospheric pressure exceeds thoracic pressure, air goes in. When these muscles relax due to the elastic nature of the lungs, the volume of the thoracic cavity decreases, increasing pressure in the thoracic cavity, pushing air out. Notice that ventilation or air moving into and out of the lungs is the result of changing the size of the thoracic cavity by contracting and relaxing ventilatory muscle groups. Certain conditions can cause difficulty in breathing. For example, with emphysema, the elasticity of the lungs is reduced. Since the elastic rebound of the lungs is needed for exhaling, emphysema results in difficulty passively exhaling. People with emphysema need to engage active expiratory muscles that reduce the volume in the thoracic cavity, such as the internal intercostals and abdominal muscles. Lung compliance is a term describing the ease at which the lungs can expand. Resistance to airflow is another factor that affects pulmonary ventilation. Certain conditions can decrease the diameter of bronchioles, thus increasing the resistance dramatically. Take, for example, asthma. In a normal airway, the bronchioles are expanded, allowing for air to travel in and out with minimal resistance. In an asthmatic, the airways are restricted, increasing the resistance at which an individual can ventilate air into and out of the lungs. As asthma attack can be caused by histamine release as an allergic reaction, epinephrine, a fight or flight hormone, results in dilation of the airways, allowing more airflow.